Hi, this is Julie Levinsky. I'm Web Manager for the Christopher and Dana Reeve Foundation. I'd like to welcome you all to another webcast with Nurse Linda. Linda Schultz, she's been a leader and a provider of rehabilitation nursing for over 30 years and a very close friend of the Christopher and Dana Reeve Foundation for close to 20 years. Soon after Christopher was paralyzed, Nurse Schultz, she worked closely with him on his recovery. And it was a special time for her. She had the opportunity to watch him evolve into a uniquely gifted advocate for people living with disabilities and paralysis. So I'd like to welcome Linda today. She has just been a joy to have in our community and has answered so many questions and has brought up so many topics that I believe are very, very useful to our online community. And I'm so happy that we have started these online discussions with her. So I will hand it over to Linda to begin the conversation today. Thanks, Linda.
Thank you, Julie. And hello, everyone, and welcome to the Ask a Nurse webinar. It's always fun to do these. We always learn a lot of things, and so it's a very interesting hour that we spend together. So today we were going to talk about aging and spinal cord injury. And so one of the first questions that have come up is when are people considered aging with a spinal cord injury? And there is some kind of terminology that's out there to define that. And one is a combination of number of years since injured plus the time at injury. So there's really nothing we can do about our aging process. We all do it. If we have paralysis, if we don't have paralysis, we all grow older, and we're all familiar with that. So the age at which we become injured or we have some kind of metabolic problem that leads to some sort of paralysis, there's really nothing we can do about that because that's the age when it happens, and we can't stop or slow that. We're all going to continue to age as the calendar indicates that we're getting older. Now, the year that we're injured, we can kind of sort of affect that a little bit. And certainly we know that the number of years since we were injured or since we became paralyzed, we can affect that length of time by maintaining our health and by maintaining our vitality and trying to keep ourselves as healthy as possible. And that, again, is true for anyone if they have paralysis or if they don't. So typically people are considered in aging with paralysis when they hit the 5-year mark after injury or if they're injured at age 50. Now, those are just numbers that are used as kind of reference points. As you know, if you are injured or you have paralysis beginning at age 60, your body's in a lot different shape than it would be if you were 20. So we know that that is something that is just a fact of life and that we all age as we go through life. The number of years injured is usually cut off about 5 years, and that's when we start thinking about aging processes because with paralysis, typically people are more sedentary. They're not as active as they used to be, and so we have a few more effects of aging as we go through since the time we became paralyzed. But there again, you could be 10 years out in your injury and still be healthier than somebody without paralysis who is a younger person. So it's all kind of arbitrary, but it kind of helps us to start to know when to look at things and when we start dealing with those kind of aging types of problems. It's not the type of thing where just one day we're suddenly old. It is an ongoing process, so we have to continue to look at those things in kind of the bigger picture. And generally what we want to do if we have paralysis or not as we age is to try to keep ourselves as healthy as possible, keep our bodies as fit as possible. Exercise plays a key part in that, making sure that we maintain our bodily functions. But we're going to take a little pause from aging because there's a lot of questions coming up. And there was also a column this month about neuropathic pain, and that is the first question of the day. So let's just forge right ahead into that. And so there's a person that has written in that they have a C3 to 4 spinal cord injury. They walk with a cane, so that's probably an incomplete injury. So they're pretty mobile, but they have some neuropathic pain in their left foot. And neuropathic pain comes from a miscommunication of those nerves trying to send signals to the brain that there's something wrong. So the neuropathic pain could be because somebody has a pain, something's bothering them, maybe they have an infection in their foot or their toe, maybe their shoes are too tight. You know, we get pain because something's bothering our body, and our body's giving us that signal to get rid of this thing that's causing us pain. In neuropathic pain, it seems to come on for no particular reason, and it's usually because those signals are miscommunicating through they're communicating normally in the part of our body below the spinal cord injury, but when we get up to that level of the injury, the messages can't always get through to the brain correctly, or the signal can't get from the brain down to the foot correctly, because we have that interruption in our nerves communicating. So that's why we have those things. And you can get treatment for those. There's for a person that's walking around, they might be able to do some stretching exercises or something to reduce that pain, looking again at all the things that anybody has to look at. Are your socks too tight? Are your shoes too tight? Sometimes your shoes can be tied too tight. Looking at what kinds of things might set that off. It looks like from the person who wrote in that this pain is just there, and so they might, if it's that bothersome to them, they might want to try some over-the-counter pain relievers to see if that works. We always start with the simplest first. But definitely if it's hampering their ability, their mobility, or they're hampering their ability to go around, they might want to talk to their healthcare professional to see what kind of treatments would be available for that. Now also this person says they have some frequent urination at night only, and I'm glad that you specified that, because this is not an unusual situation at all. When we are more sedentary, our feet and our legs tend to collect fluid. The way that our body eliminates fluid from collecting is by mobility, being up, walking around, and those muscles are squeezing as we walk around. So as we're more sedentary, either as we get older or if we're not able to move around much, fluid tends to collect first in our ankles and then in our lower legs. So when we lay down at night and put our legs up so that when we lay in bed our legs are even with our heart, that fluid then is able to come up and out of the body, and it will go through the kidneys, and we'll want to get rid of all that extra fluid. So for a lot of people, when they put their feet up at night, that happens. Now if you have a lot of edema in your legs and it's not really being taken care of by wearing the TED hose or those elastic stockings that everyone finds so utterly attractive, but if that's not taking care of it, if you put your feet up higher than your heart, then that fluid will get eliminated by gravity. Gravity actually is our friend. A lot of people laugh, oh, gravity is not our friend as we age. But gravity is actually our friend to help us get rid of excess fluid in our body. If we have trouble using our arms and hands, we can always also get some swelling in our hands and fingers and in our arms, in which case that elevation helps. Gravity helps us in toileting, both bowel and bladder. We can use gravity to help eliminate the waste from our body, which is what people do when why they toilet sitting up as opposed to any other position, because it helps facilitate that. Let's see, what else is going on? I'm reading the list down here. Oh, it needs to be a little bit louder. I assume somebody's taking care of that. Please answer. Oh, and then we have a little survey just to kind of get an idea of what people are doing, what their history is. There's somebody talking about a breakthrough about spinal cord repair and regeneration and getting oxygen to the spinal cord. And, you know, yes, absolutely. the spinal cord can repair. I think that's one of the most important pieces of information for people with spinal cord injury to have, is that in the past, for instance, years ago when I went to nursing school, we were trained that when somebody had a spinal cord injury, that was it. They were paralyzed, and that's just the way they would be from then on. But things have changed quite a bit in the last few years, even in the last 20, 25, 30 years, where there's been a lot of forward movement in repair of the spinal cord. There's a new word that we hear that's out there in treatment of neurological injury, and it's called neuroplasticity. And as you'll see in my columns, as you read the blogs periodically, you'll see I always have a comment in there: the body's trying to heal itself, and the body wants to heal itself. Just as if you get a cut on your skin, you go outside and you get a bush just gives you a little cut on your arm or something, and your skin will heal that. Your skin heals pretty quickly because it's your first defense against the world out there. So your skin heals pretty rapidly, but your internal organs will try to heal themselves too. And that includes the nervous system, but it's at a much slower rate because it doesn't expect to be injured because it's inside your body. So it's always a little slower to heal things inside the body, but there's a lot of information that is studies that are being done, a lot of very exciting things. Oxygen seems to be a very key player in this. You know, there's just an article that had come out this week about Joe Namath, the football player, and how he had concussions when he was playing football. Now, we all know the famous football player Joe Namath, and he had commented when he was playing football, people got concussions, but nobody even talked about it because it was just a part of the game. There was really nothing you could do about it. You went out and played football, you got hit in the head. It was not an uncommon occurrence, and people just talked about it. He seems to be getting a lot of comfort and recovery through hyperbaric treatment, which is oxygenation. Now that's to his brain, but that's his neural system. So you see there's quite a bit of bits and pieces out there. We just need to pull that all together, and that's what people are trying to do. Let's see. What other thing is there? Is there any medicine for neuropathic pain and frequent urination? Yes, there are all kinds of medications for neuropathic pain. You want to start out with the simplest treatment first. So start out with some medications that don't have many side effects. There are some the non-steroid inflammatories. The NSAIDs are usually given over the counter, but you do want to talk to your health professional because there are medications that can be given to people that are prescription medications. There are two medications that are for neuropathic pain. One is Neurotic and one is Lyrica. Those are the only two that work on nerve pain, and neuropathic pain is nerve pain. There are other medications that people have taken in the past that you probably want to steer away from, and those are the addictive narcotic medications. Those kind of make your brain more tired and sleepy, and it doesn't register the pain as much, but it doesn't really treat the pain itself. So you probably really want to stick with the medications that will really help with that. As far as for your urinary frequency, there are medications that you can take for frequency. If you have urodynamic testing, your prescriber can pinpoint exactly the medications that will help with that. But the reality of it is that as long as your feet are dependent when you put them up at night, it doesn't matter if you have a spinal cord injury or not. You're still going to have excessive fluid that's going to want to come off. So sometimes people will go to bed and then wait a half an hour, 45 minutes, and then do their last catheterization to remove that particular excess fluid. If you don't catheterize and you don't like that fluid that you just lay down and it's just a few minutes, now I have to get up and go to the bathroom, you can try using those elastic stockings that will help keep the fluid flowing back up so you don't have that big collection of fluid. Now there's a person that has written in about dorsal root entry zone operation. Yes. That is for neuropathic pain, and it is on the very other end of the spectrum. If you have really severe pain and it's not being able to be calmed by any medication or any other of the treatments, that might be something that people have done. Really severe pain, this is kind of like the last of the spectrum of treatment, and that is that the nerve root itself gets put to sleep there so that you don't have that pain, that miscommunication of that nerve pain. It is a very critical thing to think about. You really want to think about doing that, because once that's done, it cannot be undone. So it's something you really want to think about that. Now, a lot of people are having a lot of success with Botox, and if you haven't tried that, you might want to try that before you go with something severe as the dorsal root entry zone. Now, for people who have had the need for that dorsal root procedure, that have had severe neuropathic pain, it does take it away. There's no question about that. But people have also had a lot of relief with Botox treatment, and that's the botulinum toxin. It's the same, it's an injection, it's the same medication that is put in people's faces for cosmetics, but in a much smaller amount. You see the actors and actresses who have Botox treatment so they have no wrinkles, but they have no facial expression. It has to be done over and over again. When you have it for spasticity, it's done into the muscle area that the neuropathic pain is arising. And so those injections are given in a much larger dose, of course, than what would be done in the face. And that's been keenly successful for people who have had that. If you cannot do the Botox, there's also Baclofen, which can be taken as a pill, which is helpful for spasticity. But Baclofen also can be given through a pump, which is a little device that's implanted in the abdomen, and then there's a little tube that goes into the spine, into that dorsal root. And instead of putting Baclofen for spasticity, you can put other medications in there that will bathe that dorsal root with numbing medications. So it's not quite as permanent. It's a good fix, but it's not quite as permanent as the dorsal root treatment. So I'm not saying don't have that, or I'm not recommending one or another. I'm just saying look at all the options before jumping right out there. There's a question about an opinion about compression clothes for neuropathic pain. That is a good question. Some people get a lot of satisfaction out that if they put compression stockings on. Some people find that just raises their pain to an intolerable level. But other people find that it really is soothing to have that tightness around that it kind of calms that nerve. So it's one of those things that it's simple to try. You probably have some compression stockings or some TED hose, anti-embolytic hose. You could try that and just see if it works, how that works for you. Let's see. I'm getting some clicking on my phone, so if somebody's talking to me, I'm going to tell you I don't hear you. I just hear some clicking every now and again. So here's a person who's having some severe muscle spasms when lying flat, and that could be for a variety of reasons. Could be that you're just having some muscle spasms when your muscles stretch out from laying flat. When you're sitting, your muscles bent at the hips. So, when you stretch that muscle out, sometimes you can get some spasms.
Let him roll. Oops, lost my leg. I'm going to ask if you could, everybody listening, and if they could mute their phone lines by pressing *6 to avoid background noise. And to unmute, if you have a question, please do *6 again to unmute. But at this point, since there's a break, does anybody on the phone have any questions they would like to ask Linda? Okay, then Linda, you can keep on with the question.
Okay. Well, it seems like on our little write-in area, it seems like the tone has changed here. It seems like spasms seem to be the topic right now that people are interested in.
And that's what you just wrote about in our community, isn't that correct?
Yes, yes. Spasming, neuroplasticity.
Well, I'm sorry. If you want to read that, you can certainly go to christopherreeve.org/nurse, and she has all of her posts there, and her recent one that she posted on Monday is about muscle spasms and spasticity. So I'll let you finish questions. Thanks, nurse.
Sure. So the question is, where can I go get the Botox injections? And they are not done by everyone, so you do have to go to someone who knows exactly what they're doing. You can talk to your healthcare professional and ask them where they can go get these. Neurologists will do them for different people. Spinal cord injury specialists will do them. So those are the kinds of people you go. Now, I don't know, in your community what is available to you, so you'll have to ask your healthcare provider who does that in your area, or where you can find someone who do it. The good thing about the Botox injections is that it just works in the area where those injections are made. So if you have spasms in your leg and you have the Botox injection, that will quiet the muscle. Now, it's kind of an imperfect science in that how much do you put in. People who do this all the time, they have a good idea when they start how large of an area they want to quiet from the spasming. So they pretty much know how much to give. But you'll find that the results either work perfectly, or maybe you'll find you need just a little bit more. And the Botox does not last forever. It lasts really strongly for about 3 to 4 months. Some people can get 6 months out of them. It just depends on the area, how big the area, there's a lot of factors that go into it. So you'll work with this person, you'll come back, you'll have injections. Sometimes people say, maybe I had a little too much. My leg's not working as well as it used to, and they'll go, taper back a little bit. Sometimes you say, I'm still having the spasms, and they'll add a little bit more. So you kind of have to work with the person who's doing it. Pretty much they get it pretty quickly, but these are the kinds of things that you need to talk about. Now, as far as if you have spasms and you want to get, you can try Baclofen. It's an oral medication that helps spasming. It helps relax the muscles, but that goes all through your body. When you take a pill, it goes all through your body. Any pill you take goes all through your body. The Baclofen pump is made by different companies. You can look up on the internet. You can find providers who implant Baclofen pumps in your area. You can talk to your healthcare professional. If they treat people who have spinal cord injury, they probably know other people who've had Baclofen pumps put in. And so they will be able to recommend you to someone who does it and who does it well. There's a special training for that. Neurosurgeons put in Baclofen pumps because that tube that goes into the spinal column, which bathes the spinal column with Baclofen, that helps calm everything in the spinal column, in the lower spinal column. Now, the drug gets put into the pump, which is, it's like a pacemaker for the heart. It's a pump that's put in the abdomen underneath the skin that's just worn in the belly. And so there's no communication of this. It's all inside your body. And then there's a tube from the pump that goes to your spine. The pump is refilled periodically, which is a needle that is put in through your skin to into the pump and more medication is put in there. Now with the pump you can have more Baclofen medication because it's not going throughout your whole body. It's only going through that tube to bathe your spine. It does not go up higher in your spine where you breathe because the Baclofen drug is heavier than spinal fluid. So it always stays at the bottom of your spinal cord. So it's kind of a neat little system the way all of that works. But you do have to find a specialist that would be able to do that. So we have our person who's having the spasm when they straighten out and lay down, and he's taking all kinds of muscle relaxers. So you might want to look at the Botox to help calm that, or you might want to try some, the next step up. If you're taking all kinds of muscle relaxers, if you're taking them all at once, that's probably not really a good treatment because you're so medicated that you're not going to be able to function throughout your day. So you might want to look at other kinds of treatments. Will the Botox work for pain also? The Botox might, if the muscle is calmed and the nerve is calmed, then there's no message to be sent. So it might work. It's a possibility. It's something you should talk with your healthcare provider. Make sure it's the treatment for you. I did want to mention that there's a lot going on about, somebody had written in some questions, and it's great when people are providing information, but be careful when you start treating yourself. Having a spinal cord injury is a very, very specialized problem. Nobody knows your body better than you do, so you are the main person in this whole scenario, but be sure and talk to your healthcare provider. Sometimes I'll see people, well, they come in and they had something, they got treatment, they ordered something off the internet. I can tell you, no matter who you are, if you have a spinal cord injury, if you have paralysis, if you have anything, you can find somebody on the internet who's going to sell you a magic cure that they're happy to take your money to do so. So please be careful when you're looking at treatments. Educate yourself, but then talk to your healthcare professional, especially when we're talking about things like spasticity or treatments or hormone replacement therapy. That is on my TV every night. I have commercials for hormone replacement therapy. And it usually stems around women and their aging process. But I think there's a lot of information I know there's a lot of information out there about spinal cord injury and testosterone replacement. And for some people that is really a great cure. That's a great solution to what ails them. Testosterone replacement has been very effective in insulin control, muscle building, bone building, but it also has some severe complications such as increased risk for heart attack, increased risk of stroke. It certainly advances your aging process. So when it's necessary to take these things, it's important that you do it, but it's also important you talk to your healthcare provider because hormone replacement affects and mixes with so many other drugs. We have so many people that come in that are that have bought something over the internet. They felt good for about a month or two, and then all of a sudden they come in and they have some really huge complication because they didn't think it would mix with some other drug that they were taking or with some other kind of treatment that they're using. So these are just kind of things I always like because I don't know you or your particular condition. I can't really say what is the best thing that you should do, but I can give you suggestions that when you talk to someone who does know you in your situation, they will be able to really direct you, and you are the person who's ultimately going to make the decision if you want to try the Baclofen pump, if you want to do other kinds of treatments. So getting all the information is always a great let's see. The question is, could a colonized UTI cause muscle spasms for this person? Of course, UTIs can cause all kinds of trouble, and here again we're getting into that referred pain kind of thing, where sometimes below the level of our spinal cord injury, the messages get miscommunicated to the brain. So people who have, we all heard of people without spinal cord injury who have a heart attack, they have referred pain down their left arm. And if you have left arm pain, we all know, uh-oh, that's a big red flag for a possible heart attack. So we want to think about those kind of things. When we have a pain around the area, could it be a UTI? Sure. Could it be constipation? Sure. Could it be something from your foot that's making that pain in another spot? Sure. So we need to check all those things to make sure, because people who have no sensation from the chest down, if they have a gallbladder attack, it does not present like a gallbladder attack with pain in the side. It actually is right shoulder pain when you have a gallbladder attack. So always being able to convey information about pain that you have. Shouldn't just slough off, oh, I had a pain, but be sure and tell your healthcare professional, because they might read that pain differently than you are interpreting it. Is there an online support group I can get in touch with other paraplegic patients? And yes, it's written here in our little chat box, but I would like to give a shout out to the Paralysis Community. It's just a fabulous opportunity to connect with other people, and it's run by the Christopher and Dana Reeve Paralysis Foundation, and it really is a great opportunity because they have peer support people all over the country. They have people who are living with paralysis, and they've been living with it for a while, and they've navigated different communities. So if you can connect with the Christopher Reeve community and connect with one of these peer support, they probably know who the best healthcare professionals are that are putting Baclofen pumps in your area. They know the people who are giving Botox in your area. So if you're new to paralysis, or even if you've had paralysis for a long time, but you have some questions, these are some excellent people to connect with because they've been through these experiences. And part of the richness is they're right in your own community, so they're able to direct you to, this is a great place to go to therapy. These people in this therapy institution are doing something different over here. So it's a great way to connect. You can contribute to them also. There's another person who's written in that says, I'm having a sweating problem even if it's cold. Is there anything I can do to stop it? And you know, I guess the sweating problem needs to be identified as what's causing the sweating problem. Most people with paralysis sweat above the level of the injury and not below the level of the injury. Sweating problems can certainly be from autonomic dysreflexia, of which there are many symptoms that we're all familiar with: the headache, stuffy nose, elevated blood pressure, bounding heart rate. Sweating is one of the issues, but just because you have autonomic dysreflexia does not mean you will have all of those symptoms. Maybe sweating is the only symptom that you have. The nervous system is a very peculiar thing. It's very complicated, and it just is a little bit different for everybody. So be sure and talk to your healthcare provider to try to figure out what on earth is going on with that sweating. You really want to get on top of that and see what's going on with that. This fellow who has his legs that are having these spasms is really, it seems like it is such a huge problem for you. You really want to talk to your healthcare provider and get worked up and find out what treatments, because you're using a lot of antispasmodics, but there's medications to relax the spasms, but that doesn't seem to be working. So I would also talk to my healthcare provider and see if there's other treatments that could have some positive outcomes for you on that. He also says he has a pressure sore on his tailbone, which certainly could be causing these spasms. Again, that's that referred pain. And so a pressure sore for 2 years, that's going on a pretty long time. So the only way to get rid of a pressure sore is to stay off of it, which means laying on your side or your stomach, not sitting, but getting that healed up. Now, you think, oh, I cannot stay off of it for weeks or months at a time, but you've had it for 2 years, so you might want to do something to address that and get that healed up, because that just, is one of those things that compiles to more and more problems. And as we find as we age, we maybe didn't have pressure ulcers when we were younger, but as we all age, no matter who we are, our skin becomes less elastic, and we need that little bit of give in our skin to keep from getting pressure sores. So as our skin gets a little bit less elastic as we get older, you have a higher chance of getting pressure sores. So think about that. It says the sore heals and then it breaks back down. Yes, once a sore heals, it heals with a scar. No matter what we have happen with our skin, a scar forms once the underneath the top layer of our skin, once that dermis has been affected, the skin will scar, and scars are not elastic at all. So we have a really high chance of breaking down the second time once we've broken down the first time. So doing those pressure releases, checking your skin, using a mirror to check your skin. Always check your skin yourself. If you can't see your backside, because none of us can, we have to use a mirror. If you have a cell phone, just hold your cell phone back there and take a video of your backside or take a picture. Know what your own skin looks like. We can't see really the backs of our heels. We have to use a mirror. Our back, our bottoms, we don't really see. Where we sit on our bottoms, we don't really see. We can't see directly. So look at that mirror. Use a mirror and look. Or use a cell phone and look. Have a caretaker look with you, but know what your skin looks like. So when you see a little bit of red or changes in your skin, know to stay off of it until that heals up. And then don't go back the next day to a full day of sitting on that. Sit for an hour, sit for 15 minutes. Take a look at your skin and see how long. Build up your skin tolerance all over again. We have a lot of equipment and surfaces that we sit on, that we lay on when we sleep, when you have any kind of paralysis. So those things are all great. They're very, very helpful, but they will not 100% keep you from having a skin breakdown. You have to turn. You have to do your skin releases. So getting on top of that is going to be crucial to get that. Here we go back to driving in the van. You can't drive in the van without sweating. So something is going on with that autonomic nervous system. And if your doctor has no clue as to why it's happening, then you might ask to see a specialist to help you find out. If you see somebody who is a specialist in spinal cord injury, I'm sure they'll be able to diagnose your reason for your hypersweating. So if you see a regular healthcare professional, this might be a time to say, could I maybe see a specialist in the SCI to see why this sweating is occurring. If there's not a spinal cord injury specialist in your area, you could maybe see a neurologist or ask for a referral. Whenever something's such a big problem that it's interfering with your life, you need to find out why that is happening to you. So please feel free. It will not offend anybody if you ask them for a referral about what's going on. And then we have a person that wants to know about autonomic dysreflexia. There is a card about that on the Christopher and Dana Reeve site, and that's given just after your question about that. So autonomic dysreflexia is a problem in the autonomic nervous system. And the autonomic nervous system is part of the nervous system that controls our body functions. I like to think of it as automatically, automatically. So it's the things that we don't really think about. For instance, like our heartbeats, we don't think heartbeat, heartbeat, heartbeat. It just does that. Sweating is just a response that our body does. All of these things are automatic, so they're controlled by the autonomic nervous system. When people have a spinal cord injury, sometimes that autonomic nervous system gets out of whack, and so there's things that you can do to help control for that, but you have to be able to understand it. So please look at those cards so that you're sure you have a good idea of what's going on. Somebody else is saying something about, in their case, hypersweating was due to a UTI, and that is a part of the autonomic nervous system. It mostly gets fouled up. Primarily, the number one source of the autonomic nervous system getting kind of disorganized is usually due to a UTI. That's the number one reason. Number two is bowel impaction. And then the other things that follow, like a pressure ulcer, can set off autonomic dysreflexia. Some people's autonomic system becomes so hypersensitive that just even a little breeze blowing across their skin can set it off. But there are medications to help you control that. And of course, you want to make sure that you don't set it off. For instance, having an overfull bladder, getting a UTI, a kinking of your catheter can do it. If you wear an external catheter, sometimes those get twisted, and that can set off autonomic dysreflexia. So be sure and get that wallet card from the Christopher and Dana Reeve Paralysis Foundation, because not only does it tell you all about what it is, all about what things can happen, ways to avoid it, but also if you get caught in a real autonomic dysreflexia emergency, where your blood pressure has climbed up, you want to put your head up if you're laying down. So you just want to make sure that you know what the treatments for those are, and there's also instructions to the healthcare provider. So if you are a person with paralysis, you're having an autonomic dysreflexic episode, and you go to the hospital, even at the hospital sometimes they see so few people with spinal cord injury that they might not recognize that right away, because it's just so very rare and uncommon, until of course you're the person who has it, and then it becomes a real issue. So there's instructions to the healthcare professional also on that card. So I've known people that have taken that card to the hospital with them and say, I have spinal cord injury, I have autonomic dysreflexia, here's this card, here's what it's all about. They institute treatment, boom, it's taken care of. So those cards, those wallet cards, there are several of them on different subjects. I would recommend that you get them all. They're the size of a dollar bill, so they fit in your wallet, so you can always have it with you. And they deal with emergencies after paralysis. So there's a whole series, which are wonderful cards to get. Just talking a little bit more about aging. Sometimes I think that we can get lost in aging, anybody, if we have a spinal cord injury or not. The idea is to maintain good health so that we don't have problems as we age, keeping our joints limber, keeping all our body processes going. My New Year's resolution, which I talk about all the time because here it is May and I'm still on it, yay. But I thought, well, gee, I've always done all these real elaborate New Year's resolutions, and of course, by February they're over. But my New Year's resolution this year has been to sit up straight and to breathe deeply, because as we all age, these are some of the problems that we have in keeping our internal body systems working. So that is something that I'm telling people about all the time, and something that I'm working on. I'm sitting up straighter right now because I want to keep my respiratory system in good health. and I want to keep breathing deeply so I don't lose any lung function as I age. And so that's one of the things that I'm working on. There are other people that are doing more elaborate kinds of things to ward off the aging process after spinal cord injury. And some of you might know a fellow by the name of Patrick Rummerfield. He has a spinal cord injury, but he's a most unusual fellow because he's had a most unusual recovery. And he is going to be sailing a boat. He's out with some other fellows who have spinal cord injury, and they're sailing a boat to raise awareness and funds for spinal cord research. So there are people that are doing all kinds of things, but keeping active, keeping a positive outlook. I just had a person who wrote in, and I thought, boy, you're going to be a successful person with your aging process because they have a spinal cord injury, but that clearly did not find them. They have adapted to, well, now I just go to the bathroom differently. And they were living life to the fullest, not letting their spinal cord injury be their life. Not everybody can do that. I know we all have different issues in our lives that just consume us at different times.
So I'm going to ask if you could *6 your phone lines to mute as we're getting some residual noise from those on the phone or listening on their computer. If you could mute your line *6, and if you have a question, you can unmute it *6 again. Thanks.
So the question is on the board now is what is the average lifespan for a quad? And that is really vastly different for a lot of people. A lot has to do with mental attitude, and there's Dr. Dan who talks a lot about adapting with spinal cord injury. Also through the Paralysis Foundation, which is really an interesting, he has an interesting take on life, very realistic. So mental attitude has a lot to do with it, and then how you maintain your health. Are you taking care of problems right away, or are you just letting problems kind of collect with you? It depends a lot on when you were injured, at what age. Certainly, as we talked about in the beginning, if you were older, it's harder to adapt to such a catastrophic injury. And then how you maintain the number of years after injury, how you maintain your function, what you're doing to help yourself, the treatments that you're getting, how you are trying to maintain your health. So the average lifespan for a quad is very, very flexible. If you're a high-level quad, if you're a low-level quad, if you're ventilatory dependent, all of these things play a factor into lifespan. So, there is that commercial on TV where they said there's no expiration date written on the bottom of your foot. Christopher Reeve was an excellent example of a person who beat all the odds and, really lived a full and vast life. So, things are changing, and with all the research and all the new treatments that are coming up, things are changing at such a rapid pace that lifespan is expanding almost, it's definitely expanding yearly, and it's almost expanding monthly now. So the next question, is it possible to have spasms inside the body? Most definitely. Most definitely. Sometimes you'll feel little twitches and flutters, and that's because you can have a spasm really anywhere. There are muscles that you can feel up underneath your skin, but there are muscles that are inside deeper in your body, and those can be spasming. So yes, it's possible to have spasms. If you have spasms just throughout the body, then you would want to look at some kind of treatment that would affect the whole body as opposed to a local treatment. So, getting hooked up with a healthcare provider who has a great understanding of spinal cord injury is a good opportunity. If you don't have someone in your community, if you live in a rural area, or if you don't live close to a major center where there is a spinal cord injury specialist, you can talk with your healthcare insurer, your provider, and ask what the possibilities are for being sent to someplace where you can get workup to see what's going on with you, and then have your local providers institute that health care plan for you. So these things are all possibilities. There's a question about can stomach spasms cause nausea, and is this common? Well, yes, they sure can. And is it common? Well, let's put it this way. It's not that uncommon, and it doesn't necessarily have to come with spinal cord injury. People who have gastric problems can get spasming in their stomach for a variety of reasons, irritable bowel syndrome, any kind of GI upset. If you have an ulcer, can cause a stomach spasm, and that will give the sensation of nausea because of that cramping in your stomach. So that is not uncommon at all. And so talking about different centers where you can go, there are many excellent centers that help individuals with spinal cord injury. Some focus on advanced treatments, but every state has some kind of care. So even if you have Medicaid in your state, there should be a place or a person who can provide you with the kind of care that you will need to deal with the special needs of spinal cord injury or any kind of paralysis. So sometimes you just have to connect with the right people. Talk to your health care provider. They'll be able to direct you. Also, check with the person who is paying, or the company that is paying for your health care. If you have private insurance or if you have Medicaid, there are resources available to you. And at every payer, there's a person that works there called the nursing case manager. And that is their sole job, is to look at the quality of care of your life and to get you the resources that you need. Now, they may say no to certain treatments. Maybe you've read about something. They may say, well, we don't pay for that. Well, okay, then you know they're not going to pay for that. But over time, as more and more treatments that were once experimental are now being mainstreamed, it's just a matter of time till these treatments all become available to you. But there is somebody in your state somewhere. If you want to go to a bigger center, ask them if you're able to do that, and they might allow you to do that. The minute a health insurance company allows one patient the ability to do that, they have to allow all of their insured people to do that. So you have quite a bit of leverage on your side, but you might not know it. So connecting with these people is always good, finding out who they are, getting their name and number, just calling them up and ask them, and seeing what's going on with your case and what kinds of treatments they might be able to offer. It's not good to call up and say, what can you do for me? But, talk to them about, I'm having some spasms, I'd like some specialized treatment, maybe I'd like some advanced therapies, how could I go about getting those? Checking with your payer is a good idea because you might have benefits that you didn't even know you had. Let's see what else. If you have other forms of paralysis, there are other treatment centers. There are organizations. I'm seeing the ALS treatment centers if you have that. The Muscular Dystrophy Association has a lot of resources for people with ALS also. The MS Society has wonderful resources. There's a lot of organizations that are helping people who are focused on serving populations with particular diseases. So be sure and check into those. For our pediatric patients, don't forget March of Dimes and Easter Seals that provide a lot of services for people. So there's a lot out there once you start looking and once you start connecting with people. Maybe if you call an organization, they can't help you, but somebody there will know somebody who can. So, networking is always very important. That's what they're telling us all the time. Is at work is to network, and with a spinal cord injury, it's a good thing to network. And a great place to start is with the community program and the peer support group through the Reeve organization. That's just an excellent place to start because it really focuses on your community. So instead of talking to someone who's in a different state and they don't really know what's going on in your community, you have resources right at your fingertips. So that's a great place to go. And they have a resource list per state too. So that's a good thing, is to connect with their with that organization. Let's see. So yes, if you're having trouble with your bowels, and people with spinal cord injury do have problems with bowel evacuation. So if you're having trouble with that, you need to look at your diet, the amount of fluid that you take in. Make sure you're getting enough roughage. If you need to add roughage to your diet, there's information abounding about what kinds of things to eat. It's difficult to get bowels regulated, but once they are regulated, then you can start backing off on some of these things. So if you need to add a fiber drink or fiber cookie or increase your fluids or taking some oral medications to help eliminate the bowels. You want to use suppositories. If you don't have results one day, you can do it again. You can use the suppository again the next day. But getting those bowels regulated, eventually, you know, in years gone by we used to call it bowel training because you were training the bowel to work. We've gotten away from that terminology, but it says quite a bit because people forget that once you get your bowels in a consistent pattern, you can start backing off some of the supplements and some of the different medications. You can even start backing off some of the suppositories. Many people have their bowel movements with digital stimulation because they've got their bowel trained to respond in a certain way. So remember, you're doing all of these things, but that doesn't mean you're going to be doing all of these things forever. You're eventually going to be able to back off on some of these techniques. So if you have any questions or any thoughts, anything that you want to think about for aging, be sure and check the blog, or you can ask questions directly on the blog, and I'm happy to answer them at any time.
All right, thank you. I want to thank everybody for joining us today. And as Nurse Linda said, you are more than welcome to leave her any comments or questions on the community. You can go directly to her part in the community by going to ChristopherReeve.org/nurse. And she is dedicated an hour every Wednesday to go into the community to actually answer your questions. So they will be seen on every Wednesday. And I have noticed she pops in and out throughout the week regardless. So I appreciate that. Nurse Linda, thank you. And we will be holding another online discussion with Nurse Linda again at the end of next month, I hope. And we'll have that promoted on our website. You can also view the recorded webcasts by going to ChristopherReeve.org/webcast. And this one will be live by the end. It will be up so you can play back by the end of the week. So I want to thank you all for joining us. I want to thank you, Nurse Linda, and everybody else. And I want everybody to have a great day, and we will talk to you soon. Thank you.